let's talk about some diabetes memory tricks to remember type 1 versus type 2 diabetes. In terms of pathology, let's talk about the difference. In type 1, we have no insulin production at all. You can remember this by the memory trick type 1, we have none. But for type 2, we have insulin, there just isn't enough, or it produces bad insulin that doesn't really work. So a memory trick for this is terrible 2s are bad. Next, we have the onset. Type 1 diabetes is usually diagnosed in childhood, and type 2 is usually diagnosed in adulthood. This is easy to remember because childhood comes first in life and adulthood comes second. Now let's talk about treatment. Type 1 has only one treatment, which is insulin. Type 1 diabetics can't take oral hypoglycemic agents like metformin. They can only take insulin. So type 1 has one treatment. But for type 2 diabetics, they have 2 or more treatments, things like insulin and oral hypoglycemic agents like metformin. Now, it's important to remember that insulin isn't a routine medication for type 2 diabetics. Insulin is only given in times of stress, surgery, or sickness in the type 2 diabetic. You can find this diabetes study guide and more nursing notes in the Complete Nursing School bundle.